my claim that since the source my opponent has offered revealing the amount of deaths supposedly linked to sugary drinks is not very relevant because it states that it is the first research to prove that sugary drinks are linked to deaths. This proves that more research should be done to confirm this claim. Also, the research done in this source was in 2010. That was about 4 years ago, so things could have easily changed since then. I feel my opponent should have a more reliable and less outdated source to prove this. I will agree with my opponent that where these deaths occurred doesn't necessarily matter much, as death is a serious harm regardless. But I would like to argue that the wording in her source is crucial to analyze. It states that these deaths are due to over consuming sugary drinks, not just from drinking them in general. Sugary drinks should not be banned from primary and secondary schools because there is no study proving that occasional consumption of the drinks leads to death. This is why I propose education of health risks over a ban, because by educating children on the health risks associated with drinking sugary drinks, they will be able to make their own decisions and choose to limit their consumption. I'm going to read an excerpt from the Canadian Medical Association Journal. It states, the New York City Board of Health has unanimously approved, effective March 2013, a limit of 16 ounces on the maximum size of sugar-sweetened beverages that can be sold at restaurants and concessions in the city. This is the most recent in a series of innovative public health measures pioneered by the city under Mayor Michael Bloomberg. Previous successes have included drastic restrictions on trans fats in restaurant meals, requirements for chain restaurants to display calorie information, the launch of a national collaboration to reduce sodium in foods, and a recent initiative to remove a disincentive to breastfeeding by restricting the distribution of infant formula in hospitals. These limits, which have been being put into effect, have proven to be very successful and have begun to combat obesity and therefore all other health risks associated with it. Instead of banning sugary drinks from school, legislation should implement laws which mandate alternate methods of education on nutrition and health. Besides health classes and physical education programs, these alternate methods of education could include limiting the maximum size of sugary drinks, sweetened beverages in primary and secondary schools. This would teach children to drink responsibly and in moderation. As I stated earlier, consumption of sugary drinks in primary and secondary schools can be related to consumption of alcohol in teens. If the drinks are banned or taken away from the kids entirely, they will have no exposure to them and will therefore never learn to drink in moderation. Once they have access to the drinks again, they will binge drink and have little to no control over their drinking. In the case of alcohol, if a teen never drinks until he or she goes away to college, it's much more likely that they will not know their limits, and when they go away, they'll become too intoxicated when they drink for the first time. This can lead to poor decision making and, in extreme cases, death. Similarly, if sugary drinks are not sold in primary and secondary schools, children will not know how to drink them in moderation when they graduate from these schools, and they will binge drink, resulting in health risks such as obesity and eventually death. These two things, education on health risks of sugary drinks and a ban on sugary drinks in schools, cannot go together because if sugary drinks are banned, children will not be able to teach themselves self-control even if they are educated on the health risks of consuming sugary drinks. The judge should vote for me because my opponent did not prove that consumption of sugary drinks in general directly leads to death. Also, the cons outweigh the pros in her proposition to disallow the sale of sugary drinks in primary and secondary schools.